4 years ago, I went to the hospital with my mother for an MRI. After waiting for 2 hours, I was taken to a 2x2 room without any windows, where I waited alone for somebody to come. Then I was told that my mother's cancer was at an advanced stage. This is a very painful memory for me. Not only because of the news I received, but also of how I received it. I did not understand where I was, who was talking to me, and why my mother was not with me. It was not the fault of the person in front of me, but I had the feeling to be a chess piece in a hospital with my mother. There is a huge gap between what happens in this room, the use, and how it was designed. And it struck me because I am a designer. The user experience is not adapted, and that's the issue. If the design of those hospitals was centered on people who suffer from disease, and not only the disease, it will change everything. If you put yourself in a child's shoes, as the designer Doug Dietz did, you can understand how stressful an MRI can be for a child in those white, sanitized hospital room. So Doug Dietz transformed an exam room into a pirate ship, where now it helped children to calm down. When I worked with people suffering from Alzheimer's at the Nice hospital, I realized that they have heightened emotion reactions. So together, we designed an interactive color wall. Sounds and colors do not only make the walls nicer, but it can either stimulate or calm down patients at a hospital. There are more unusual projects. In Düsseldorf, a designer helped a nursing home. She observed that patients who suffer from Alzheimer's often escape from the hospital because of their disease. And she noticed that they often go looking for public transportations to take them home because they just feel lost. So she designed a fake bus stop close to the retirement home. And now patients can find easily the medical staff. If we design hospitals centered on the needs and the emotions of patients, family, and the medical staff, we will improve the healing process. Solving a problem through an empathic approach, this is what we call design. But to do that, we have to look beyond the treatment. We have to consider the inside and the outside of hospitals. We have to consider the user experience before, during, and after an hospitalization. This is what we call care pathways. It includes the 360 experience of care of patients. I worked with specialists on the care pathway of people who suffer from obesity and who need, for medical reasons, a surgery. 8 out of 10 people operated will relapse after 5 or 10 years. By observing their behaviors, we realized that they don't often know every step they have to make before the surgery. And after the surgery, some have difficulties managing their meals. Despite this, they just have 1 appointment every 6 months with the doctors. These surgeries paid by the welfare system are inefficient because of roadblocks and challenges happening outside the hospital. So we designed an innovative continuous care pathway. We allowed patients to take control of their own treatment through a mobile app. It remotely delivers personalized psychological and nutrition advices given by the medical staff. To do that, we used an approach named design thinking to prototype solutions with the surgeons and the patients. These patients, who are now actors of their own well-being, we think they will heal better, and obesity will cost less to the health system. Obesity is just an example of chronic disease, which is the first cause of mortality in the world and will increase. Treatment is not enough. Prevention and continuous care are needed. The healthcare world cannot be reduced to separate boxes: a hospital, a medical office, a patient's home, a pharmacy. People go from one box to another. And no one better than the patients know what they experience between these boxes. This is why we need collaborative and empathic approach as design thinking to work with the patients to develop better, optimized, and intuitive care pathways. So we need to work through design thinking to work with all the team, patients, family, and the medical staff. In this 2x2 room, where I learned how sick my mother was, I would have dreamed of a better process to communicate with the medical staff. In healthcare, we are talking about human interactions, and both patients and the medical staff have difficulties and emotions. This is why we need to change how we think health. The healthcare world already tries to optimize its process using tools coming from the industry as lean management. But it can't be enough, because patients need not to be anymore patient. Humans have already two big powers: empathy and creativity, which can be heightened in the healthcare world through design thinking to enhance our future healthcare experiences. Thank you.